Are you strong enough to do the activities that you are trying to do? And so that comes into your sort of your cross training and your daily PT. What are the things you're doing to maintain your body to make sure that you do have the strength, that you do have the flexibility? Are you making sure your technique is correct and that you're not forcing turnout or forcing extensions, pushing yourself beyond what your body can do appropriately? So some of those extrinsic things that we really look at, your nutrition, all of that is important for making sure that you're preventing many types or all types of injuries. That control the things that you can control, right?
Amanda and Andrea, thank you so much for taking the time to chat with us today.
Thank you for having us.
I'm excited to be here.
So I want to start with each of your backgrounds, both of which include dance training at a high level. So whoever wants to go first, tell us about your how you first got into dance and what your early training was like, and where you both trained.
Yep. So I came from the suburbs of Chicago, where I actually started as a rhythmic gymnast, had some injuries and issues there, and transitioned over to dance more around the age of 12. So I was considered a late starter, maybe 11, started taking some classes and then fully transitioned at 12. And danced through high school in a private studio and my dance team in high school. And then I went to Goucher College, where I met you, Pete. I was a dance major there. And at the same time, I took all my pre-physical therapy classes. I had dealt with injuries throughout high school, and I already had kind of an idea that I wanted to go into the dance medicine field and probably not pursue professional performing. Once I was out of PT school and working as a PT, I then also danced as a cheerleader for the Baltimore Blast cheerleaders, some more jazz, hip hop. It's a really nice way to be able to continue dancing while I was actually then working full time. And through my physical therapy education, I worked on specializing in performing arts from the very beginning. I did one of my clinical affiliations when I was a student. I did my affiliation with Performing Arts PT in New York City, where we worked with a lot of Broadway shows and other professional dancers. And then through the years, I've worked in a couple of clinics here at Hopkins for 10 years now, and working with dancers, actors, musicians, sort of going through the whole gamut of performing artists, gymnasts, figure skaters sometimes. And that's where I am now.
Yeah. And then I started dance at the age of 3. My mom used to take class. She was a dancer as well, not to probably the high caliber that I had been able to get to, but I started at 3. I would attend classes with her and couldn't sit still in the corner, so she enrolled me. I was born in New Jersey, was raised primarily in Southern California, a little bit in Florida, and then finished high school in New Jersey. So through that time, I got to spend a lot of time in private studios, but then also with kind of local chamber ballets in each state. And then when I got to New Jersey, was dancing with New Jersey Ballet School. And so with that, we were able to go through junior company. So really kind of in the pre-professional program, dancing with the company members there. I had done summer intensive, so with Boston Ballet and with American Ballet Theater. And so with those experiences, really was looking at dancing professionally, and had a little bit of exposure with physical therapists. My parents kind of pushed me into going to school, more so than pursuing professional dance. So I decided to dance professionally and go to school at the same time. So very telling of my personality. But So I danced with New Jersey Ballet Company as an apprentice into the Corps of Ballet. I was accepted into physical therapy school for a 5.5-year master's program at University of Hartford. So that was where it was, as soon as I applied, I was in the physical therapy program. I kind of chose that with my experiences from physical therapists and just my really big fascination with the human body. And I loved anatomy and science. So I was like, okay, if I can't dance, what could I do? So the first 3 years was undergrad degree. I was able to dance. I danced every weekend. I commuted back to New Jersey from Connecticut. I had it kind of within contract with the company that I would keep up my body work. I would take class when I was at school. And so then once I hit the 3-year mark where we graduated with our undergrad, I had to stop dancing because it got really intense with the master's portion. So I paused. I danced with dance team competitively up in Hartford as I finished my master's. And then so in part of clinical of like what Amanda was saying, how she had more of a focus in performing arts, I always knew that I wanted to work with dancers just from my passion and love with that. So after I graduated, I moved down here to Baltimore to work at Hopkins. And there was no performing arts program really at the time, but I missed dance. So I started taking classes at Peabody Institute, and they had an adult program. And actually one of the teachers, when I had to audition for the adult program, was a guy I danced with at AET. So everything kind of came full circle. And then they asked me to be a guest artist. So then I was dancing with their preparatory program in performances, doing some freelance work in Baltimore City. So kind of came back to it after I received my master's, and then eventually kind of now fizzled out. I take class from time to time.
Okay, so real quick, Andrea, let's touch on this because you said undergraduate degree at the same time as you were dancing professionally. Talk about that for a minute. How did that work in terms of scheduling, in terms of, I don't know, studying, in terms of maintaining your body to be prepared to jump in and jump on stage?
Yeah, it was, looking back on it, I was like, how did I do that? A lot of time management to learn. But I was able to kind of change my class load schedule where I would literally I wouldn't have Friday classes so that I could then take transportation. I would take the bus to New York City to meet my friends. So then that's where on the bus I would study, or I would be studying a lot during the week. I would take class, I believe, like 3 times a week. I was working out at the gym like 1 or twice when I could, but then it was pretty intense and just taking class, and you're in rehearsal Friday evening, Saturday, and then rehearsal all day Sunday. And then I would either take a really late bus ride home to Hartford, or I would leave like 4:30 a.m. on Monday morning to make it for my 8 a.m. class. So my mom at the time was like, "You're crazy." My parents were like, "You're crazy," but I wanted to dance. And that's where people have asked me before, like, why didn't you like go to school for dance? And I went to Hartford knowing that if I didn't like physical therapy, they had a dance program. And really when I went, I was like, well, can I minor in dance? And they're like, well, with the rigor of physical therapy, and, I had to stay on track with the specific, pre-PT classes in order to go right into the master's program. Everything was so structured that I couldn't even get into taking the dance classes. So, I would take classes with some of the dance team, and then I would also take classes with the Heart School and take some of their ballet classes. So it was a lot of time management, and I had a good support group of my PT school friends too, where we would always be studying. But yeah, my friends thought I was crazy a lot of the time that I was doing this. And right, it would ebb and flow around like Nutcracker season. During that time, I traveled to Ohio. We went down to North Carolina. There was one year that we did more traveling. So it kind of worked out in timing with the way that collegiate academic calendar went, but I did have to kind of see if I could take finals early or, work around test schedules. Not ideal. I wouldn't recommend it.
Well, it's one of those things, either one of those things is a heavy load. Yeah. So to manage both at the same time is huge. And then you mentioned the Hopkins program. So you got down here and you said there wasn't really a performing arts specific PT program. How did that start? It's my understanding that you two were both involved in the initiation of this program. Is that accurate? And how did that all come about?
So it's not quite accurate. I'm going to let Andrea start with where it started. I came on a few years later. I think we probably both started practicing in Baltimore around the same time, and I was with another clinic, and then connected with Andrea actually at the International Association of Dance Medicine and Science annual conference. Was in DC one year. We were both there, and that's where we connected. And through that meeting, I eventually came over to Hopkins.
Got it. So I started at Hopkins in 2009, so coming up on 14 years. And so when I came down here for the position, I was at Green Spring Station, which is a very kind of common clinic that Hopkins is known for out in the community. And we were really the only community clinic. And that really what drew me to Hopkins was just, the mentorship, the academic institution, the type of, name that it has behind it. So when I came down here, I actually was just, I wanted to be a sponge, right? When coming out of PT school, you're not really trained to be as specialized, you're really a generalist. And so I was really seeing everything from orthopedics to neuro. Then I went into women's health and treating women's health patients. And then as I was dancing at Peabody, a lot of the parents and students got drift of what my day job was. So then I was getting a lot of them in clinic and treating them in clinic. Around 2011, Towson University was looking for physical therapists to come in and screen their dancers and create kind of this collaboration. So that brought some more traction. So with Peabody and with Towson and just kind of me dancing in the community, that started to spike it. And then as Amanda was saying, we met in 2012 at iAdams. And so we were able to bring her on and help really kind of then start to grow the program as we were seeing volumes were increasing and the demand was increasing for this patient population.
And then Amanda, talk about how you came on and to join the program and got involved.
Yeah, so I, having done my training as in PT school, in performing arts specifically, really knowing why I wanted to do performing arts. When I came to Baltimore, I was with another company who, we were hoping to start and build a performing arts program there. And I wasn't getting quite the support that I needed to build that type of a program. I was seeing some dancers here and there, but it was just a different type of environment. It wasn't the type of environment where we could provide one-on-one care, which is really, I think in our minds, very important with dancers, with performing artists in general, that you're providing one-on-one care. And so when I met Andrea, and then I met some of the rest of the team here at Hopkins, I realized that this was really much more of the type of environment where we could provide the kind of care that we wanted to provide to performing artists. And I think being a part of a team where you really truly have other people who are invested in building this type of a program, we all, there's a cheesy phrase, right? We all do more when we work together, things like that. And it really is true. I think as the two of us came together, and then gradually we have more and more people who are involved in the performing arts program with different specializations, whether that's figure skating or musicians, being their backgrounds. We've been able to really achieve much more together than I think we, could individually.
So tell us about the Hopkins program and specifically what your work consists of. What kind of patients do you see? And what are some of the long-term goals you have for the program?
Yeah, so we now have how many clinics? 10 maybe outpatient clinics. Some of those they're across the Baltimore area. We don't have performing arts clinicians at all of those clinics, but we do at many of them. We, day to day see patients in the clinic, taking care of injuries that have come up and helping them rehab so they're getting back to their arts, whether that's music or dance or figure skating or gymnastics. Helping people who are injured, but then there are other pieces of things that we do. Here at Hopkins, we have this tripartite mission that we're working on, both clinical care, but we're also working on education and research. And so within that, we also work on a lot of community type activities. So doing injury prevention screenings, providing backstage physical therapy care that might be more of kind of maintenance, try to prevent injuries from occurring during busy performance seasons. Working on dance medicine and performing arts medicine research, so that we are looking at different research studies in the performing arts medicine world, and then education, so that we're educating future performing arts leaders. And I'll let Andrea talk a little bit more about that.
Yeah, and so of course, right, we've kind of built this program, and now I think more of seeing more dancers or students that are interested in kind of our career paths and how we've been able to kind of, really create this niche, that we have built a performing arts fellowship program. So very similar to how physicians are, where they can go through residency once they graduate med school, and then fellowship to get very specialized. It's not required for physical therapists, but there is programming to do that. So there are residency programs where it's really focused curriculum and mentorship, right? So you're getting one-on-one mentorship, and then kind of the next layer over residency is then fellowship. And so there's only 3 accredited fellowships in the country in performing arts. So it's a relatively new description of practice for physical therapists in fellowship. And so, with our programming here, and, we started with dance, we've evolved to musicians, we have figure skating, and a little bit of the gymnastics side. I really felt that we had the patient population, we have the resources to provide an immersive experience for a clinician that is interested in this. And so that's really where we want to train the next physical therapists to be able to really understand these performing artists and really start to evolve this niche as well. We're a little bit behind sports, right? We've looked at sports programming, we've looked at sports medicine. Performing arts is kind of this newer, thing. So we're really trying to kind of be at the forefront of what is performing arts medicine.
And, when we came up, it was to develop a specialization in performing arts. It was really through working, trying to get mentorship, whether that was as a student or when you came out of school, seeking out continuing education courses, but you really had to kind of piecemeal your specialization in performing arts. And now it's a much more clear path. If you're a physical therapist who wants to go into performing arts medicine, there's a clearer path to being able to say, I can take a residency and then take a performing arts fellowship and become that expert without kind of having to piecemeal things together.
And in a lot less time,
Yes.
Like sometimes it can take, 5-6 years before maybe you're doing exactly what you want to do, or get your foot in the door to work with a company. So it's providing you that just accelerated training, but yes, ultimately providing those experiences to give you the understanding of how to care for them.
So it seems with what you're building that significant and stable backing would be absolutely critical. And so have you been getting that from Hopkins? It seems like you have with the way that you've been building the program. What kind of backing and support have you been getting from the administration so that you can build this program and see this vision through?
I think that's where our program has been so successful, because our director and administrators are very, very supportive of this programming. And they saw the unique, type of program it is, and also how successful it's been. And so, right, with just our postgraduate education, we have quite a few. We have about 9 or 10 postgraduate education programs. So it was just, I have the support of our other clinicians and directors that head up those programs, but also looking at, within the Hopkins system, right? Peabody Institute is part of the university. And we've been a lot more collaborative in terms with the university that, Amanda was able to kind of get us started with working collaboratively with Peabody, that it was a no-brainer to keep pushing this programming along because of looking at the Baltimore, community. There is quite a bit of performing arts patients here.
And I think at the end of the day, also, healthcare is an industry. We at Hopkins, we're non-for-profit, but we do still need to be able to make money to keep the lights on and buy the supplies and take care of everybody. And so our bread and butter is treating patients, and that is where we make money to be able to do these other activities. And so being able to have grown our clinical care, and the more patients that we're treating and the more that we were able to show, like, yes, there is a huge population of performing artists who want to come and get care, being able to show that and being able to increase the numbers of patients that we treat every year, of performing arts patients that we treat every year, is a part of that as well. Having to show that that there's a need for care for these patients, and that we're getting these patients better. And so I think at the end of the day, that's kind of always all these other things that we're doing. It all comes down to treating patients is where we start. And it's where we started, and it's where we'll always be also. And is another big piece of our goal is like the satisfaction of being able to work with for me, definitely dancer is because I was a dancer. To go see your performing artist perform without pain is, at the end of the day, really another goal that we're always striving for, is to see more artists keep performing without pain.
So I definitely want to dive into that more in a minute, but I'm curious, before we do, if you've started to get, because you had mentioned, Andrea, having worked with Towson early on to screen dancers. How have you seen your program extend into the community? Have you seen reaction from the colleges, from the universities at a local level? I guess taking advantage of the fact that you're building this program, have you been in touch with them? Has there been any communication?
Yeah, our community programs have really grown. So with Towson, a lot of that screening, it wasn't necessarily for like injury prevention. It was more that they were interested to see, is their curriculum making their dancers worse or better? And it was a discussion amongst the faculty. And so now I'm on as adjunct faculty, and we still screen the dancers, all of them. And we've been doing it since 2011. So the dancers actually use their data, they get it. And it's very much a functional screen. It's not looking at like necessarily your flexibility. It's looking at asymmetries, motor control. We do look at turnout. We look at cardiovascular endurance, core strength, things like that. Just kind of where are they at? And they're required to be screened every single year until they graduate. So depending if they come in as a transfer or if they come in, sophomore year, they might have 3 or 4 screens. But it really kind of, you see them evolve over time. But they use it in more of their scientific inquiry class, where they're learning, it's kind of their anatomy for dancers class, which I think is a nice layer of, they're not just doing it and they like forget about it and they don't see it ever again, and it's just for our benefit. It was really used as a tool for them in their curriculum. And I think we saw such success with that. So then we screen at Peabody as well. And we use kind of the same screen, but even before that, we had private studios reach out to us saying they wanted to screen their dancers just to kind of see where they're at. When we think of injury screening, we always think of, okay, this is going to help us with injury management, but you have to do a lot of injury surveillance in order to really understand, like, do your tests that you're measuring, are they able to predict injury? And it's really hard to do. You need to have a lot of data, a lot of tracking. So that's where we really came up with this functional screen so that you can see where your numbers, what's kind of like the baseline, and then maybe what's your action plan. And a lot of times it goes to cross training. It goes to, symmetry of movement, not forcing your turnout. And then just recently, we've been working with Howard County dance down there. And then we've done a little,
over the years, we did. So I did some curriculum in one of the Howard County high schools with their dance classes. We've done, excuse me, some research along with Goucher College, with Elizabeth Ahern over there. We did some research looking at Pilates and its impact on some different flexibility, strength, posture, things like that with dancers. We have a clinic on site at the Peabody Institute now. So we've really been involved in a lot of different places. We do pre-point screenings as well. Those are usually more people will get referred to us and come see us at the clinic for a pre-point screening. If there are teachers who have a concern about a particular dancer who's maybe some clinics or some studios do their own screenings. If they have a concern about a dancer who's not passing their screening, sometimes they'll send them over to us to do something like that. And then also sometimes just injury prevention talks and lectures at different schools, at both the college level, the studio level, and the high school level.
Okay.
And the professional level as well, sometimes with some of the theaters in the area. Yeah.
Okay, I want to dive into some of this. I was gonna cover talking about career a little bit, but I wanna stick on this practical track for a little bit, because I think that it's one of the things that Becca and I take very seriously, that our whole team of teachers actually takes very seriously, is particularly injury prevention, but really I like to think of it as body maintenance in the same way that you maintain your car. And it requires a sort of, I sort of have joked, but not really joked, that we should all be doing daily PT every day of our lives forever. And that's just what it is. And, it's part of the maintenance. So let's start with, what are some of the most common injuries you see? Let's, in particular for dancers, what are some of the most common injuries you see? And what would you generally recommend to help prevent them?
So I think some of the prevention pieces I kind of need to break that question into two parts, because some of the prevention pieces are very much the same for all of our different injuries. Because when we have an injury, we talk about both intrinsic factors and extrinsic factors that cause the injury. And intrinsic factors are things inside your body that you may not be able to change. So it might be your body structure in a certain area, or it might be the type of muscle fiber that you have, things that we can't necessarily change. But the extrinsic factors are things we can change. And so those are most important for being able to prevent injuries. And so those are things like, are you wearing the proper footwear for the dance technique that you're doing? Because if you're in sneakers that are sticky and you're trying to turn, that is going to potentially put torque on your lower extremity and potentially cause injuries. Are you overworking? So are you fatigued? Fatigue is a huge piece that we see leading to injuries. Are you strong enough to do the activities that you are trying to do? And so that comes into your cross training and your daily PT. What are the things you're doing to maintain your body to make sure that you do have the strength, that you do have the flexibility? Are you making sure your technique is correct and that you're not forcing turnout or forcing extensions, pushing yourself beyond what your body can do appropriately? So some of those extrinsic things that we really look at, your nutrition, all of that is important for making sure that you're preventing many types or all types of injuries, that control the things that you can control, right?
And that's where, like, in terms of the types of injuries, the most general kind of injury we see is overuse, right? So we work our body in the same repetition. Choreography might be run over and over again, technique class. So really kind of just generally it's overuse versus acute traumatic. Where they fall in body region, it usually is more kind of in the lower leg. So foot and ankle is kind of the number one, especially for ballet dancers, or even if, a female dancer is dancing on point. And then looking at kind of hip, low back. And then, if you're more modern, doing a lot more partner work, counterbalance, lifts. Sometimes it is a little bit more in the upper extremity. We know stress fractures do happen, right? And of course, that kind of goes into those extrinsic factors like Amanda was saying. So a lot of times it is looking at nutrition and looking at load that this dancer is dancing at, especially when they're a younger dancer and they're experiencing a stress fracture at that time. We have to really kind of, take a peek in of, are you dancing too much, but also are you fueling and recovering your body? Because that's where we don't want to set them up for failure if they are looking for a professional career. But yeah, we have, in our professional dancers, the one-offs of, concussion or an ACL tear. ACL tears are actually not as common in dancers compared to the athletes. But from time to time, we've had some, there are some, hip labral tears, repairs that we have rehabbed, but a lot of the time it's overuse. And so kind of talking about that injury management, it's also understanding the signs of what is good pain versus bad pain. And I think that's our biggest factor of when we go out into the community and educate dancers and even dance educators as well, is understanding and identifying what's alarming and what can be pushed through. Because sometimes that alone, right, you can be so far into pain that you keep just dancing through pain. It makes it more challenging and can take a longer duration to recover from the longer you are in pain.
I want to go back and touch on something you both just mentioned. So since you both mentioned it, it must be important, right? Which is nutrition. And it's something that I'm very much speaking for myself here, but I don't think it's talked about enough in dance, and in a lot of ways for good reasons. But it also means that the information that people need to, like you said, fuel yourselves for high athletic activity isn't being distributed. It's not being talked about. What are some of the things that happen that let's say happen physically when a dancer isn't getting the nutrition they need to be able to maintain this high level of performance?
Yeah, I mean, it's really their system starts to kind of shut down, right? If you think about when you're really hungry, it's hard to focus and think about the brain demand, but then also in terms of precision of movement, of being able to have that motor control or that quickness, your muscles kind of get dried up, especially if you're not hydrating too, but also the energy, we need that glucose, that sugar, to be able to actually make our muscles activate. So if you're not fueling your body either before or after, right, your muscles can't absorb that demand or that impact of like even jumping or having to partner with someone. Balance becomes off, right? You're just kind of in this brain fog all of the time. So that's really where it's understanding those signs of, okay, you need to fuel maybe even after a performance, because then you're under lights then too, right? And you're pushing your adrenaline even more. And also think of how long a technique class alone is. It can be an hour to hour and a half or so, right? You're kind of stopping and going, but you're still exerting your body. You're increasing your heart rate. You're asking a lot of demand for your body.
And if you don't have that fuel to give you the energy that you need to do those things, that's where you can start to have muscle breakdown that can lead to those overuse injuries, but also those acute injuries. If the muscles aren't prepared to do what you're asking them to do, then they're going to break down at some point.
And one of the things, just to add to that, that I found is you had mentioned fatigue, Amanda, in one of your previous answers, and I often have found that fatigue of the mind is just as likely to cause an injury as fatigue in the body, because you're not paying attention. And like you said, Andrea, when you're hungry, you can't focus. And so all of your movement becomes a little bit less refined and is more likely, especially dancing on point, intensely on point, at a high level, much more likely to get an injury. And
Absolutely.
have you found, especially with lower leg injuries with dancers, I guess any sort of pattern in long-term, how do I say this? They seem to linger. Is that pretty common? And is there anything that you would recommend for an injury early on in the process of recovery that can help to prevent that lingering injury long term?
I mean, I think the key is getting care for it from a medical professional early on, so that you know what needs to be done to take care of it. Lower extremities are tough because even when you're not dancing, most of us are walking. So, it can be hard to decrease the load on the lower extremities. And so often they linger because we continue to overuse them. And so you do need to also think about, we talk about kind of cumulative load on your body, and particularly your lower extremities. You need to think about the things that you're doing, not just when you're dancing, but also, are you walking around a big college campus to get to class? Are you running up and down 3 flights of stairs in a Baltimore City row home? Like, what are the other things that you're doing that are adding to the load? So I think that that's a big piece of why those things tend to linger as well.
Yeah, and I think of just one common injury we see is a lot of times ankle sprains, right? And the amount of time like a dancer has just rolled their ankle or I tweaked it. And those types of things can linger. And that's really where if you've had your first big ankle sprain, of like Amanda said, like seek medical attention. And you might be doing those exercises for a year out, because especially the stability of the ankle that we need and the amount of load from jumping and just walking, they can flare up pretty easily. So that's where it's really seeking care early on, and then continuing those kind of mind-body somatics practices, strengthening, cross-training to continue with it. It's not just, I'm going to do 6 visits of PT and it'll go away and it's great. It might feel great, but you might have to keep doing it. Think how long you've been dancing for and how long you've worked up to getting to be able to do maybe a double pirouette or fouettes. You have to kind of do the same repetitive training when it comes to just exercises and retraining, maybe out of even bad habits that could be contributing to this chronic, lingering injury pain.
And I think that goes to what Pete, you said earlier about, that it's a joke that everybody should be doing daily PT. And I don't think that's a joke at all. I often use the analogy with patients that like we brush our teeth every day so we don't get cavities. There are certain exercises and certain, body maintenance techniques that you should also be using every day so that your body feels good. And that's for everyone. That's not just for dancers or performing artists. That's truly for everyone, but even more important for people who are using their bodies in the way that dancers do.
We had talked, I was talking to someone about this, who was in their 60s, I think, who was commenting on how exhausted their feet were. And I was thinking about it as dancers, as pedestrians, how much we ask of our lower leg. Like we really ask a lot of it, and often don't take care of it, on the other end. But even more so for dancers, obviously, because of how much we're using our feet and ankles. So what kinds of things would you recommend dancers do? Because we're not what we do today, we're what we do every day. So what would you recommend for dancers to do on a daily or an almost daily basis to help maintain themselves, to prevent injury? And one of the things that I want to insist on for my students is that they can dance forever. Like I don't want your bodies to
I don't want you to push certain things so hard that your bodies prevent you from being able to get into the studio for as long as you want. And so what kind of things would you recommend for dancers?
What I like to tell dancers, or even just our average person, is to almost kind of check in with yourself, right? Every day you're not going to feel the same. You have all these external factors, but in terms of, where am I feeling pain? Do I feel stiffness? That's all going to determine on, okay, do I need to do more flexibility and do more recovery? We think, okay, I have to take class, or I have to be doing something to exert myself every single day, but actually taking a recovery day, maybe that's doing absolutely nothing, or going for a walk, or going to a yoga class. That's just as important in kind of your weekly schedule. Maybe it's a couple of times a week, depending on the rigor of going into performance season. But anything from mobilizing your joints, so whether they feel like really sticky or compressed. So active, motion can maybe help with a dynamic warm up. Getting into more cross training. So whether that is strength training or doing more kind of HIIT training, core, Pilates, gyrotonics, swimming, just depends on your schedule. And I think that's where when we tell people to do things that make them feel good, but making sure you do a proper warm up and cool down is also going to help you prepare for the next day. So I think if a dancer can only do one thing, or really two things, is warm up and cool down, right? And what that person's warm up might be different from the next person. Whether I have to do a lot of core to center myself. I'm not sitting and hanging out into my over splits, or sitting in a split and talking to my friends. Maybe I'm using a massage ball. Everyone loves these, percussive Theraguns. So you're trying to prep your tissues, but then after class, taking the time to actually cool down your body. And then of course, knowing, okay, I'm not going to start a strength training routine or a cardiovascular routine the week before shows, that you're actually preparing, and that time management piece of looking anywhere from 8 to 12 weeks before maybe you have a really big, intense performance. So loading your system and your body. So maybe you're doing a lot more strength and cardio in the beginning as you're just taking regular classes. And then when you're in longer rehearsals, maybe you're taking more time in your day to stretch, roll out, do maybe a little bit more core work. And then as you get closer to performance, it's a lot more recovery.
And so that's why I think it's hard to give us specific items that every dancer should do, because every dancer is so different. And we're looking at, again, where she said where you are in your performance season and things like that is so important. I think if you want to ask the couple of things that for most of our dancers, we would say here are things that you should definitely do, are core work and cardio work. Again, very much going to depend on the dancer, but many dancers, those are areas where class isn't getting them what they need. And if you were going to pick two cross training things to work on, that's where I would typically go with most of my dancers.
Mm-hmm.
Great. Let's talk about, no, please go ahead, Andrea.
No,
please.
And add a recovery day.
Add a recovery day.
Yeah.
Let me talk about recovery day first, and then I'm going to come back to cardio real quick. Recovery day. So one of the things that I've talked to with athletic trainers is that dancers don't have an off season. Mm-hmm. Every other sport, every other athletic type of athletic has an off season of some kind, and dancers just don't. And I get why. It seems to me, at least from my experience, that with the way that we train and with the muscle usage that with the muscles that we use, that letting them go for too long takes too long to build them back up. My general guide for injury, and you can tell me what you think about this, is I usually tell dancers that roughly however long you've been out, that's how long it's going to take you to get back to where you were when you stopped. I don't know if that's a rough, I'd usually use that as a rough guideline. But the point is that time off really does work against you. Too much time off really does work against you, but an off season is important. And so what it seems to me is that a lot of dancers, when they do take time off, they don't give themselves adequate time to get back to where they were. They just sort of try to push themselves, and then they end up injured from that whole process. So do you have any sort of guidelines on optimal time off? Like, should dancers take an off season, 2 months, a month? Or should dancers do something like work in rest days throughout their process and keep more of a steady pace, but with incremental rest?
So I think that's hard because it depends on the dancer and what their season looks like. If you're looking at a Broadway performer, like there truly are not true off seasons. They only have the option for off days, versus if you're looking at a college dancer who might have the summer off completely. They might be doing some kind of a summer intensive over the summer. Hard to say, but there is potentially a situation where they may have more of an off. Or if you're looking at a high school, primarily ballet dancer who may be training all year round, but is going to have performance seasons that are heavier in terms of rehearsals. So each different, person is going to be very different. And that's where getting some professional help to figure out what your rest and recovery needs to look like is important. I think one of the biggest things that we do see though frequently is if someone does finally have time to be off completely, they do nothing instead of doing something that's different than dancing. And then all of a sudden, when it's time to come back to dance, they go from 0 to 100. And so being able to, if you do have time that's truly off, to have a true break, that you are still doing other types of cross training during that time. And that you then, when you get back to college in the fall, you're going to have to do, 5 days a week of dancing, that you're trying to prepare yourself somehow with building yourself gradually to a few days a week in those weeks leading up to it, which is sometimes, easier said than done, depending on class schedules and things like that. But if you are in a situation where you are dancing all the time and there is truly no break, if you are getting one break day a week, then that break day, I'd say, let's not be doing heavy strength training or like in any kind of intense cross training, but instead maybe focusing more on your body recovery type things on your off day.
Yeah.
Right.
I mean, it can be anywhere from a day or a week. Very rare we'll say a month or anything like that. I think what comes with, recovery and we've been pushing kind of this kind of mental health and recovery piece is the burnout too. A lot of dancers are trying to catch up still from lost time of, where we were with COVID, and they feel like they lost out, and now they're back into class and they want to take every summer intensive, which is great, but it's also being mindful of, the burnout piece too. So those dancers might have to just take a little bit more time away, but right, like Amanda was saying, you're still doing some sort of mind body somatics practice, Pilates, yoga, whatever it might be that you enjoy, in order to just decompress a little bit and maintain your body.
And this conversation is different for a dancer who's injured versus a dancer who is not injured. So a dancer who's injured and has maybe been working through something, and we're trying to maintain and get them through a performance season, let's say, and it was something that they were kind of pushing through. We may have very different recommendations during their rest period and their off, if they get an off season of any sort, than we would for someone else.
Right. I do want to jump back to cardio, though, because that is something that I have also found, both personally and among my dancers, that is lacking. It's lacking, and it's really hard. I did for about a year and a half, a few years ago, before the pandemic, I was swimming, and that was definitely one of the things that kept me moving through that period. In college, I ran, and the summer after college, I ran a lot. I wasn't dancing so much, but I did develop shin splints over time, and it was something that I actually tried again a few years later to get back into running and couldn't because my shin splints flared up almost immediately. And I had talked to a few athletes in the past about how rough running is on your hips and knees. And especially for dancers who really, really need their hips and knees, it's finding ways to get good cardio in is difficult. So what recommendations would you have? I mean, obviously swimming, but not everybody has access to a pool or the time to swim because it takes time. You have to add 20 minutes on each end just to get in the gym and get yourself ready. So what do you recommend for dancers typically, especially if they're recovering from injury and can't do things high impact but need the cardio?
So I am very passionate about cardio for most people, particularly dancers. I think it's important to note that there have actually been studies done that look at the cardiovascular demands of class and the cardiovascular demands of performance in dancers. And class does not prepare you for the cardiovascular demands of performance. That is well known in the dance medicine world and in the dance research world. So you are 100% correct to be, making sure you're trying to get your dancers into some cardio. And that cardio, the best cardio is going to depend on the dancer. While running is higher impact than some other types of cardio, I do caution sometimes when people say, well, dancers shouldn't run at all. I think it depends on the situation. And so if running is what you enjoy and you're doing it without pain and problems, and if that's the cardio you're going to do, the higher impact load of running is worth it to do the cardio if it means you're going to do cardio. If your option is run or nothing because I don't have access to a pool and I don't like to do anything else and running isn't causing you a problem, please run. So I want to go with the running piece to start. But running is not the right option for many people because of that higher impact, that higher load. There are lots of other good options for cardio. Like you said, swimming is going to be one of the lower impact ones that we do really like, harder to do. Biking is great. But also walking is great. Sometimes people feel like, well, walking isn't enough cardio. But if you are adding an incline to that or adding weights to that, often walking can get your heart rate up to where it needs to be. So frequently walking is not seen as, something that can be done for cardio, but it truly can. Rowing can be great. Ellipticals, a lot of times dancers like ellipticals, they are lower impact. So that can be a better one for many dancers. There are some of those cardio dance class type things now, like Zumba. I think there are other ones out there. So the cardio that's best for you is the cardio that you enjoy, that you'll commit to doing regularly and that isn't hurting your body.
Or even jump rope. I like to have patients do. It's a little bit more kind of HIIT training though, right? You're not going to be jump roping for 10 minutes. I don't think it might be a world record or something, but right. But also looking at, long duration cardio, and then also doing a bit of your HIIT training, which is kind of your on for 40 seconds, take a break for 20, right? Because that's very similar to how our classes are, right? We do a combination, we stop and watch. We do a combination, we stop and watch, or we run a part of the second act and then we stop. So then when you go to run the entire act and maybe you're in 3 parts or 3 pieces of it, right? Your endurance is having to go. So it's really also doing cardio that focuses on those 2 aspects of holding an endurance, kind of a lower moderate exertion, and then times of really, hit, peak, and then rest, and peak and rest.
I have noticed that I was watching Petit Allegro the other day, and I realized that it's like a HIIT, it's like a HIIT workout, but then we get on stage and we do 3-minute variations, and we wonder why we can't get through them. But it's a completely different type of training. And I do wonder if there are ways maybe that we can start to work some of that longer cardio training into our classes. I mean, it's kind of hard because ballet is set up in a certain way to create a certain result, but there obviously are some areas where the training's lacking and needs to be refined a little bit. That's definitely one of them.
Yeah, modern pieces can be like 10 minutes long, right? And so you really need a lot of cardio to get through those. A lot of
right. And even if they're not high intensity, just being on stage and having your adrenaline going and all of that, it's being under, like you said, one of you mentioned earlier, being under the lights. The increased temperature of being on stage under the lights is enough to push our systems further than they're used to. And it's not super common to see injuries on stage, but it certainly happens. And for very good reasons. There's a lot that we don't prepare ourselves for in terms of being on stage.
And that's the key too, is preparing yourself for the way you're going to perform. That's kind of an aside here from the cardio, but just as though we want to make sure we have our cardiovascular training up so that we can handle the loads of performance, you also want to make sure that you've prepared for, can you perform with different lighting situations? Can you perform in your costume? What shoes are you wearing to perform? Are you rehearsing in those? If you have an injury and you're managing with tape or a brace, are you going to be allowed to use that for performance? If not, you need to make sure that you're practicing and rehearsing without those assistive devices to make sure that you've practiced the way that you are going to perform.
Okay, so that's a good place to start to wrap up. Was there anything you wanted to add? If someone wanted to come see you at one of your programs and one of your clinics, how would they go about doing that?
Yeah, so they could look us up on the web. There's a Johns Hopkins website specifically about our performing arts program. We will include a link to that, I think. But if you just search for Johns Hopkins Performing Arts Physical Therapy, you'll find the website. There's phone numbers there to be able to schedule with a performing arts clinician. We always tell patients, make sure you let the schedulers know that you are a dancer or musician. That will help with access and being able to try to get you in sooner.
And depending on your location, we have many different providers out in our surrounding clinic. So, hopefully it's somewhere close to home or what works with your schedule. But yes, feel free to reach out and be happy to work with you.
Well, Amanda and Andrea, I just wanted to thank you both for being here and really for the work that you're doing. I really do feel like it's really, really important for dancers to take advantage of the type of program that you have. I really do believe that dancers, we have one dancer who drops into our classes once in a while who's 88 now, I think, or 89, and that's what I want. Like, I get frustrated when I see dancers as adults frustrated because their bodies don't move like they want them to. And, all of our bodies lose it at some point, but I want dancers to be, at least our dancers, to be able to go for as long as they possibly can. So thank you for what you're doing. And at Hopkins of all places, really, really great work. Both of you, great work with the program, and thank you.
Thank you for having us.
It was great to be here.